Welcome to my channel, Body Talk. Muscle atrophy, the loss or weakening of muscular mass, is known as muscle atrophy. Muscle atrophy or neurogenic disorders may be the cause. One limb being smaller than the other, a decrease in muscle mass, and tingling weakness. A numbness in your limbs are some of the symptoms. Exercise and a nutritious diet help restore disuse atrophy. Overview: what is muscle atrophy? Muscle atrophy. What is it? The loss or thinning of your muscular tissue is known as muscle atrophy. Your strength and muscular mass will decline if your muscles are atrophied. Your muscles appear smaller than usual when you have muscular atrophy. Malnutrition, aging, heredity, inactivity, and certain medical disorders can all cause muscle atrophy. Muscle loss due to insufficient use is known as disuse physiologic atrophy. Diseases or disorders of the nerves cause neurogenic atrophy. Symptoms and causes: what are the symptoms of muscle atrophy? The source of your ailment will determine the signs of muscular atrophy. Reduced muscle mass is the most noticeable symptom of muscular atrophy. The following are other indicators of muscular atrophy. One arm or leg is smaller than the other. A weakness in one leg or arm. Your arms and legs feeling numb or tingly. Having trouble balancing or walking. Trouble speaking or swallowing. Weakness in the face. Progressive memory loss. What does muscle atrophy feel like? You may have tingling, numbness, or weakness in your arms and legs if you have limb muscle atrophy. You may experience weakness in your facial muscles and have trouble speaking or swallowing if you have atrophied muscles in your throat or face. Why do muscles atrophy? The type of muscular atrophy you have determines its cause. Lack of muscular use results in disuse, physiologic atrophy. Your body won't waste the energy required to maintain your muscles if you quit utilizing them. Rather, your muscles will begin to deteriorate, resulting in a reduction in their size and power. An injury or illness that affects the nerves that connect your muscles can result in neurogenic atrophy. Damage to these nerves prevents them from causing the muscular spasms required to increase muscle activity. Your body believes you are no longer in need of your muscles when they are not contracting. As a result, they get weaker and smaller as your body begins to break them down. How long does it take muscles to atrophy? Your age, level of fitness, and the reason of atrophy all affect how long it takes for your muscles to atrophy. Within 2 to 3 weeks of not utilizing your muscles, the process of muscular atrophy may begin if it is a physiological result of disuse. Depending on your health, neurogenic muscle atrophy may appear sooner or later. Diagnosis and tests: how is muscle atrophy diagnosed? Your doctor will examine you physically and inquire about your symptoms in order to identify muscular atrophy. They will measure the muscle mass in your arms and legs. Additionally, your doctor might prescribe tests like the following: blood test, a biopsy of a muscle or nerve, ECG or electromyography, research on nerve conduction, X-rays. Can muscle atrophy be reversed? Exercise and a nutritious diet can occasionally reverse disuse physiologic atrophy. You could begin a program that involves swimming pool exercises with your healthcare provider. You can lessen the strain on your muscles by exercising in the water. Due to the physical harm done to your nerves, neurogenic atrophy is usually irreversible. What therapies are applied to atrophy of the muscles? The type of muscle atrophy determines the course of treatment. Regular exercise and improved diet can help treat disuse physiologic atrophy. Your doctor might suggest physical therapy or an exercise regimen. You can still perform workouts while wearing a brace or splint even. If you are unable to actively move some of your joints, electrodes will be applied to your skin. Over your muscles by your physical therapist. Your muscles and nerves receive little electrical impulses from the electrodes. The electrical impulses attempt to contract or exercise your muscles artificially. You may preserve your strength and muscular mass by doing this. Ultrasound therapy might also be suggested by your physical therapist. Sound waves are used in ultrasound therapy to encourage muscle repair. Your doctor may operate to treat a contracture that develops as a result of your muscular atrophy. When your muscular tissues start to get fibrous, you get a contracture. This tissue hinders movement and makes it difficult to extend the muscle. Outlook. Prognosis: how long does it take to recover from muscle atrophy? The kind of atrophy and the severity of your ailment determine how long it takes to rebuild muscle following atrophy. Though it won't happen right away, disuse physiologic atrophy is typically reversible. A good diet and regular exercise might help you recover from muscle atrophy. After a few months, you might notice some improvement, but it might take much longer for your strength to entirely return. Additional common questions: what is the difference between muscle atrophy and muscle hypertrophy? Loss of muscle mass is known as muscular atrophy. An increase in muscle mass is known as muscular hypertrophy. Your muscles become thicker or larger. An increase in the amount of your muscle cells causes muscular hypertrophy. Exercise regimens like strength training or high-intensity interval training, HIIT, can cause you to gain muscle. I'll thank you for viewing if you like this video and all the others I upload. You may also like and subscribe to all of my future videos. See you shortly.